Hello and welcome to this session on General Complaint Handling Principles under the ISCAS Code. My name is Suzy Ashworth. I'm an independent adjudicator working with ISCAS, the Independent Sector Complaints Adjudication Service. In this session, which is the first of four, I'm going to talk to you about the following things: why good complaints management is important, the overall principles of good complaints handling, what the ISCAS Code covers and what it doesn't, the overall structure of the complaints process under the code, documentation and accessibility, timescales and confidentiality. And before we start, I'm going to invite you to get hold of a copy of the ISCAS Code 2022, which is the core document for complaints handling within the ISCAS scheme, and which covers all three stages of the procedure. I'm going to invite you to read through pages 3 to 7 of the document, just so you can get a feel for the things that I'm about to talk about. So why don't you just pause this video for a few moments whilst you do that and resume when you're ready. Okay, let's have a look at why good complaints management is important. The first thing to say is that good complaints handling should be the cornerstone of good governance in a private hospital or clinic. Your patients will give you the most accurate and objective information about how you're doing. So actively seeking feedback, good or bad, gives you the best chance of enhancing and improving the quality of care and service that you provide. Bad complaints handling can be a real reputational risk to a service provider in circumstances where people can express their concerns to such a wide audience so easily. The way that you approach complaints and concerns can make a real difference to how your organisation is perceived in the wider world and can give you a competitive edge. Being able to show that you have a real organisational commitment to customer-focused service delivery is a huge selling point in the market for private healthcare. The ISCAS Code provides a detailed framework for how to manage complaints and concerns. In this series of 4 sessions, I'm going to take you through it and explain how it works in a practical way to enable you to do an excellent job at complaints management. The better you can follow the provisions of the code as you go through the complaints handling process, particularly at an early stage, the more likely you will be to resolve the complaint and to avoid customer frustration, reputational risk, and a long drawn-out process that just causes more stress to everyone involved. Also, if the matter does become an adjudication, and unfortunately the odd one will no matter what you do, you're less likely to be met with an adjudicator's award of a significant goodwill payment at the end of it. So thank you for giving me a bit of your time today to go through this with you, and I hope that you will find that it pays off in the long run. Let's look at some overall principles of good complaints handling and the importance of customer-focused practice. If there's one thing that I'd really like you to keep in your head as we go through these sessions, it's the concept of being customer-focused. As you take a complainant through the process, I'd suggest really trying to put yourself into that complainant's shoes and think about what they need from you and what you would want to see from the hospital and organisation if you were them. From an adjudicator's point of view, I can tell you that many complaints go unresolved because the complainants don't feel that they've been properly heard or that their concerns have been taken seriously. Taking the time early on to listen properly to what a complainant is saying and really teasing out what exactly the complaint is about can go a long way towards finding effective resolution of a complaint just by itself. Many of the organisations who subscribe to ISCAS offer services both to private patients and to NHS-funded patients. The ISCAS Code applies only to privately funded patients, whether they are funded on a self-pay basis or through insurance products. It does not apply to NHS-funded patients. However, the principles of effective complaints handling apply across the board to all patients and underpin both the NHS and independent sector schemes. I recommend these to you as a really good way of thinking about how you manage all complaints. They are promoting a just and learning culture, welcoming complaints in a positive way, being thorough and fair, and giving fair and accountable responses. These are explained in more detail on page 7 of the code, if you want to have a look at that. The next thing I would like to talk about is what the ISCAS Code covers and what it doesn't. When you're dealing with complaints from private patients, it's really important to understand the scope of the code. So what kind of complaints you're expected to look into and address, and what kind of concerns are not within your remit. As I'm sure you'll know, a complaint can be about any aspect of care or service, from the quality of the food or a failure of a staff member to be sufficiently polite, right through to the behaviour of or the standard of care provided by a medical consultant, and everything in between. One key thing that the complaints process can't do is deal with allegations of negligence and associated requests for compensation. I'll come on to that in more detail in a bit, but it's important to say at this stage that just because a complainant says that they are seeking compensation or a refund, that shouldn't stop you from addressing the underlying complaint. It's about thinking, what is this really about? Usually, something has gone wrong in the patient's eyes, and they want to understand what happened and to achieve some kind of acknowledgement of their upset. What you can say early on is that allegations of negligence and requests for compensation can't be dealt with under the complaint process because legal matters of causation and liability have to be determined by a court, but that you can commit to looking into what happened and to trying to resolve their concerns. Whether the complainant alleges negligence or not, there are still matters to be investigated, learning to acquire, and potential remedies to offer. And doing this in an open and transparent way can mean that any potential legal action is avoided. In the adjudicator's experience, if a complainant asks for compensation, it doesn't necessarily mean that it might not resolve the complaint if, for example, you tell them about measures put in place as a result of their feedback to avoid a repeat, and you offer a small goodwill payment. This can work. That said, even if the complainant does start legal action, the complaint process can and should continue in parallel. One does not exclude the other. In many cases, the legal action commenced will be against the treating medical professional, and there will be separate and important lessons for the hospital and organisation to learn from the same set of circumstances, which is what the complaint process should focus upon. The complaint process covers everyone working in or through your hospital. This includes both those with practicing privileges, like surgeons, and those directly employed or employed through agencies, like nurses, physiotherapists, and even the accounts team. It doesn't matter whether the patient makes the complaint themselves or someone does so on their behalf with their consent. I would ask you please to take on board that it's inappropriate to ask complainants to contact consultants directly to complain about the care that they've received within your premises. Your membership of the ISCAS scheme means that you are the point of contact for complaints about your consultants, and you will lead in dealing with them. The complaint process doesn't cover complaints about criminal behaviour, which should be referred to the police. It also doesn't cover alleged breaches of a professional regulatory code, such as those set by the NMC for nurses or by the GMC for doctors. However, allegations of unprofessional behaviour are covered by the code. So again, it's worth thinking carefully about what the complaint is really about, what the hospital can and should investigate, and what can be learned from the concerns raised, and where you may need to draw the line. Complaints about data protection issues fall outside the code, as these can only be dealt with by the Information Commissioner's Office, and alleged breaches of the Mental Health Act should be put to the relevant system regulator. However, complaints in these areas can also raise issues about service quality that you may wish to investigate in order to learn more about how your organisation is performing, and these do fall within the code. Again, it's worth considering that your effective complaints management, including active listening and collaborating with the complainant on opportunities for resolution, can help to head off other potential complaints to other bodies. So now we've covered general principles and what the complaints process can deal with. Next, we're going to look at the structure of the complaints handling process, and I want to give you a bit of an overview about how it all works. The structure of the ISCAS Code is a structure that I hope you should be familiar with, because it will ordinarily be the structure that your organisation's internal complaint process follows. The code requires that complaints should be raised, in the first instance, locally with the hospital, clinic or centre where the circumstances of the complaint arose, and that this centre will investigate and respond at stage 1 of the complaints process. If it's not possible to resolve the complaint locally at stage 1, the complaint can be escalated to stage 2, which requires an internal review of the investigation and response at stage 1. This review should be carried out by a senior staff member who has not been involved with the complaint handling at an earlier stage and is able to take an objective perspective on the matter. If it is not possible to resolve the complaint at stage 2, the complaint can be escalated to stage 3. Stage 3 of the process is external review by way of adjudication, which is when it comes to me or one of my colleagues, and we will consider all of the evidence and make decisions about the complaint. There is no appeal from adjudication at stage 3. The key takeaway from this is that the better the complaint handling by the local centre at stage 1, the less likely it is that the complaint will get any further than that. The better the complaint handling at stage 1, the better for everybody. Well, let's have a look at the timescales involved in goods complaints handling under the code. People should be encouraged to raise complaints as soon as possible after the event has occurred, and certainly within 6 months. However, sometimes it isn't possible to do this. For example, if the issues only come to light later, if there's been a long recovery from surgery, or if people have been grieving after a death. So there is a discretion to accept complaints made later than 6 months after the event, and that's something for organisations to think about in the circumstances of each individual case. Once again, I would encourage you to be customer focused and to approach complaints positively by thinking, what can we learn from this now? Can it still reasonably be investigated, or has too much time passed? And is it fair that we should take this complaint on? So going back to look at the principles of effective complaint handling that I talked about earlier. If the complaint is not resolved at stage 1, the complainant has a further 6 months to escalate it to stage 2. If not resolved at stage 2, there is a further 6 months to escalate to ISCAS for stage 3 independent adjudication. The aim is that each stage of the internal complaint process should usually take no more than 3 months to complete, except where the matter is highly complex. ISCAS adjudications are usually completed within 3 to 6 months. There are expectations in the code regarding the timeliness of responses to correspondence and also about updating complainants regarding progress made and delays encountered. We will go through these in more detail in the next session. So let's have a look at how people access your complaint procedure. Your complaint procedure is your organisation's key patient-facing document, and it should be in line with the ISCAS Code and easily available to anybody accessing your services through clinic or hospital. Your complaint process should be clearly signposted on your website, so people do not have to hunt for it, which only causes frustration and can suggest to patients that you're making it difficult for them to complain. Making a complaint process easily accessible can of course mean different things to different people. As we all know, there are patients who don't use computers, particularly those who are elderly or with some disabilities. So it's really important that there are measures in place to ensure that giving feedback is possible for everyone. This might mean sending out copies of the complaint process in print form and having them widely available on the premises. As adjudicators, we would encourage both. The complaint process should be accessible to everybody without discrimination. The final overriding issue I want to raise in this session is confidentiality. It's not unusual to get relatives bringing complaints on behalf of patients, and it's really important to ensure that you go through the relevant procedures to enable this to be done appropriately. This means getting the patient's written consent for someone else to act on their behalf, and I would remind you of the importance of not sharing any confidential details with or taking instructions from a representative without the express written consent of the patient, unless exceptional circumstances apply, of course. You'd be surprised at how often we as adjudicators find that this fundamental requirement has been overlooked. As you go through the complaint procedure, confidentiality also extends obviously to only sharing information as far as you need to about a complainant's medical conditions or history, and that should be a real guiding light of your complaint procedure as well. It's important to get specific consent for any necessary sharing outside the bounds of the internal complaint process, for example, if you're engaging an independent clinical expert to give an opinion. Okay, so I hope that covers general complaints principles. In the next session, I'm going to look at practical local complaints management at stage 1. Then after that, we're going to look at the review stage at stage 2, and then what happens when you're involving ISCAS at stage 3. I hope you found this general principles session useful. Thanks for watching and listening, and see you next time.